Dr. Bakare. I'm a GP clinical lead in London. So the Help Us Help You campaign primarily responds to the impact of the COVID-19 on the NHS services. NHS England wants people to understand what the cancer symptoms might be, and also to know that the NHS is here to respond to any concerns they may have in a safe manner, and primarily that we shouldn't delay seeing our GP if we have any symptoms that could be of concern. It focuses primarily at this phase of the campaign on abdominal cancers, urological cancers, and lung cancer, and looks at symptoms relating to diarrhea and discomfort in the abdomen that's been present for 3 weeks or more, or any blood in the urine. We also look at lung cancer slightly separately, and there we talk about a cough that's lasted for 3 weeks or more that isn't COVID-19 as a symptom that could potentially be an indicator of cancer and a reason to go and see your GP as soon as possible.
You've said it too.
Just a bit uncomfortable.
Just a bit of tummy trouble.
Just a bit of blood. That's new.
So abdominal cancers include those relating to the bowel, the esophagus or food pipe, the stomach itself, the pancreas, in women, the ovaries or the uterus. Urological cancers relate to the prostate in men, the kidneys or the bladder. If we're talking about which symptoms we're discussing specifically, relating to the abdominal cancers, we look at persistent diarrhea, prolonged discomfort in the stomach or abdomen, if you've got any blood in your urine, even just once, and then other symptoms that may also be an indicator like persistent bloating, constipation, or blood in your stool. If you've had any of these symptoms for 3 weeks or more, please tell your GP. In addition, if you find any lumps in the abdominal area, if you're bleeding, but you've already undergone menopause and you're bleeding vaginally, or you've got any unexplained weight loss, I'd also encourage you to please see your GP as these may be signs of cancer. So these are among the cancers that are most impacted by the pandemic. So we've had fewer patients undergoing treatment for lung, abdominal, and urological cancers since March 2020. And we've got recent data that tells us that abdominal and urological cancers account for about 44% of all cancer diagnoses in England, and about 41% of all cancer deaths in England also. When it comes to lung cancer, we know that it accounts for about 12% of all cancer diagnoses and about 20% of all cancer deaths. So pretty big proportions. It's vital, therefore, that we raise public awareness about what symptoms to look out for. So we know that often there are cultural, religious, and potential language barriers preventing people from seeing their doctor. And research suggests that these factors may be even more significant within African and South Asian communities. We also know that there's sometimes a strong fear of cancer and perhaps a misperception that it's incurable or that it quickly leads to death. We also know that people sometimes don't realize that the symptoms could be serious and therefore are more likely to self-treat when in fact they should be seeking medical help and attention. There's been some research conducted in August 2021 that looks at sort of respondents and attitudes towards symptoms and other signs that could relate to cancer. And consistently across sort of several different symptom groups like blood in the urine or prolonged diarrhea, for instance, that actually Black respondents were less likely to recognize these as potential symptoms of cancer. So if I give you an example, within this piece of research, 65% of Black respondents were aware that diarrhea for 3 weeks or more may be a sign of cancer, but this is compared to 73% of the general public, sort of as a wider whole. And it's for these reasons that it's important that we make these communities aware of what these potential symptoms are and encourage them to come forward as soon as there are any concerns.
You've said it too.
Just a bit uncomfortable.
Just a bit of tummy trouble.
Just a bit of blood. That's new.
If you've had discomfort or diarrhea for 3 weeks or more, or seen blood in your pee, even just once, it could be a sign of cancer. It's probably nothing serious, but finding cancer early makes it more treatable. Just contact your GP practice.
So for the abdominal urological campaigns, we're targeting people aged 50 and over. And that is because 9 in 10 cases of these cancer occur in those over the age of 50. Abdominal cancers and urological cancers, in fact, can affect people of all ages, but we do know that the risk increases as you get older. It's for this reason that people need to be made aware of which symptoms to look out for, and they should talk to their GP at the earliest opportunity. With lung cancer, we're looking at people aged over 60, because we know that people over 60 account for about 89% of lung cancer diagnosis in England. And it's for that reason, again, that we're trying to make sure that they are aware of which symptoms to look out for, and that it is critically important to engage their GPs as early as possible. So when we're talking about the abdominal urological cancers, primarily is if you've had diarrhea or any abdominal discomfort lasting for 3 weeks or more. There are other symptoms which, if they persist, could also be indicators, like bloating that's persistent, constipation, which is unusual for you, nausea or feeling sick, or blood in your stool. You should speak to your GP at the earliest availability if you've had any of these symptoms or other unusual changes. So if you're female, for instance, and you've had unexplained vaginal bleeding or bleeding after you've had your menopause from the vagina, these are symptoms that may signify something important. If you find a lump anywhere on your abdomen or you've had unintentional weight loss, again, these are potentially serious symptoms that could indicate something going on. Or if you've had a change in the way or the frequency of your urine, so if you're having to pass urine a lot more frequently, or if you have an urge to pass urine that is irresistible and you have to go at that time, please consider going to see your GP and discussing these. With the lung cancer campaign, if you've had a cough for 3 weeks or more that isn't related to COVID-19, this is something that we would encourage you to go and discuss with your GP, in addition to some other symptoms as well, which include persistent breathlessness. If you've had a long-standing cough that seems to be getting worse, if you've had any aches or pains when you're coughing, this could also be an indicator. Additionally, if you're persistently tired or lacking in energy, or again, this unexplained weight loss, would also encourage you to go and see your GP at your earliest availability. Sometimes people may not associate these symptoms with cancer, is the first thing. So there's, maybe a lack of recognition, or they put their symptoms down to another health condition and think it's related to something else, or they fear that they may be burdening their GP unduly and that, they've got enough to deal with, or it could be simply that they think the symptoms are occurring because they're getting older, where this is, not necessarily the case. These symptoms that we've discussed can be strong indicators for something potentially serious going on. So before March 2020, we know that, some people wouldn't go and see their GP anyway before the pandemic. The pandemic has made this even worse. So people are now, for various reasons, even less likely to go and see their GP. So when the pandemic first hit, the cancer referral rates dropped. That's now changed, thankfully. And we're now recording record numbers of referrals in the last few months, and we need that to continue. So cancers are much more likely to be treated successfully if they're caught at an early stage. So for instance, if caught at the earliest stage, bowel cancer patients have a 90% survival at 5 years. With ovarian cancer in women, 92.8% of them survive 5 years or more. That's compared to 13% if the cancer is diagnosed at a really advanced stage. That's the ovarian cancer. Similarly, with lung cancer, if it's caught at stage 1, there's a 57% plus 5-year survival rate. However, if it's caught at stage 4, that 57% drops all the way down to 3%, thus highlighting the importance of catching this very early. It's so important that we make the public aware of these symptoms and what to look out for. And that's what this whole campaign is targeted at. So as a community, we need to talk more about cancer and not ignore symptoms until they become serious. I urge people to contact their GP, even if you've had a cough for just 3 weeks or more. It could be a sign of cancer, and this symptom should not be ignored. Likewise, if you've had blood in your urine just once, or if you've had any abdominal discomfort or diarrhea that's lasted for longer than 3 weeks, it should also be checked out straight away. Finding cancer early makes it easier to treat. Don't worry about wasting our time. Don't ignore it. See your GP straight away. We want to see you.